Okay, most people who become interested in homosexuality as a subject do so because they were forced to. Most people really would rather not even think about homosexuality unless something is happening in their life. Either they're counselors or professionals, or a loved one is dealing with this problem, or they're dealing with the problem themselves. Otherwise, people would really rather not think about it. But what I want to do is present a developmental model. This is not about blame or making people feel bad. I know that many parents will be watching this video or even listening to this. So it's not about blame or guilt. It's really to educate. So I'm going to present a model to you that we have found repeatedly at our clinic, a developmental model and a treatable program that seems to work for the clients that we work with. You decide if it's relevant to your life, if you think it fits someone you know. But what we do have, what we will be presenting here is scientifically based. There's a lot of scientific and empirical evidence to support this presentation. So to begin with, homosexuality is not a sexual problem, it's a gender identity problem. Homosexuality is not about sex. Gay apologists would have us believe that it's only sexual orientation, that the person is normal and natural in every way except for his sexual choice. And we find it to be completely the opposite. Homosexuality is about self-esteem, it's about one's sense of oneself, about his relationships, his past hurts. Homosexuality is about childhood wounds, self-image, personal shame, and his belief in his ability to establish and sustain relational intimacy. Homosexual behavior is always, my wife says, when you speak publicly, never speak in absolutes. I'm saying homosexuality is always prompted by an inner sense of loneliness and emptiness. And that's what the focus is of the therapy. The focus is not on the sexual behavior, it's on the preceding feeling about oneself before he has the impulse to act out. One client who's been working with me for about 2 years, and I've been really pushing this point that it's really not about homosexuality, finally after 2 years he finally got it. He's a physician with 3 kids, by the way. And he said to me, I finally figured it out. The good news is I don't have a sexual problem. The bad news is that I have a problem with everything else. But he's right. The everything else is about oneself. We have 4 gay myths that are being promoted in our culture. Number 1, 10% of the population is homosexual. Don't believe it. That was promoted by Kinsey in the 1950s and has been repeated as a lie for over 50, 60 years now. Kinsey himself was a homosexual. In fact, he was a masochistic homosexual, and in a recent biography talked about how he got sexual pleasure from receiving pain. This was the great expert in the 1950s teaching America about the sexuality. Number 2, you're born gay. That's a myth that's being promoted. Once gay, always gay. I guess that requires 2 clips. I don't know how that happened. Once gay, always gay. Luckily, we're hearing more and more testimonies from men and women who are willing to come forth and tell their stories, because we need faces. I can stand up here, and all the other scientific experts can stand up, but you need faces, you need stories to convince people that change is possible. Number 4, homosexuality is normal in every way. That's the other mythology that's being promoted. Gay characters on television, in the media, are always the normal, well-adjusted. The gay man is preppy looking, wholesome, happy, good-looking, hip, at peace with himself. It's usually the heterosexual guy who has the insecurities about his sexuality. If you can believe 1, 2, 3, and 4, then the conclusion is total acceptance. And that's exactly what the gay agenda is promoting, total acceptance. But we make the distinction between tolerance and approval. And we're living in an age of sound bites, and people get confused. But we're making the distinction between tolerance versus approval. In other words, we are tolerant of people. People have a right to pursue their life, pursue happiness, how they want. But it does not mean that we have to give approval. We can withhold approval. And we make the distinction, well, let's go back. Informed disapproval does not mean homophobia. So we can hold a position of disapproval which is informed, it's educated. And we get our education from seminars like this today, from our reading, from our education, from talking to people, including our own religious traditions. Our own religious traditions give us insight and understanding that we can certainly bring into an argument. We don't have to feel that our religion has nothing to do with our development of our views of homosexuality. I always make the distinction between gay versus homosexual, and it's very important to make that distinction. People want to use the term synonymously, and gay activists would want us to use homosexual and gay as synonymous, but we make the distinction. Gay is a social political identity. It's basically saying, this is who I am, it's normal and natural for me. Homosexuality, on the other hand, is a simple description of a sexual preference. It's a psychological condition. Our clients are dealing with homosexuality, but they are not gay identified. Now that I've made that distinction, I want to complicate it with this statement: there is no such thing as a homosexual. There is no such thing as a homosexual. I remember a father calling me up a while back. He said, our 15-year-old son just announced that he is a homosexual, and we're looking for a psychologist that we can really trust, who can tell us, is he homosexual or not? I said, he's not. They said, how do you know? You haven't seen him yet. I said, I know, because he is a hetero. His body was designed for the opposite sex. And it's amazing how many people really believe that, even if you're religious people, believe that God created two kinds of people, homosexuals and heterosexuals. How many leaders of our church actually believe that? If you believe that, you throw the natural law on its head. And the theology of the body is completely out the window. Homosexuality is a gender identity disorder. And this is the point that we say repeatedly, that homosexuality is in most cases a gender identity disorder. There were two gay men standing on the street corner, and a beautiful woman walks by, and one gay man says to the other, it's moments like this that I wish I was a lesbian. You see, because he's confused. It's a gender identity confusion. A little humor. So homosexuality is not about sex, it's about the sense of oneself. And homosexuality is a masculine inferiority. And through sex, he hopes to make that compensation for his own inferiority. What I'd like to do is present a developmental model of this homosexual condition. And now some of the researchers may disagree with this, but this is the pattern that we see repeatedly at our clinic. So again, look at this, evaluate it, you decide if you think this fits your life or someone you know. So we're talking about, to begin with, the gender identity phase. We're talking about 1.5 to 3 years old. The gender identity phase is a very important phase when the boy, now we'll be talking about male psychology. Female psychology, as all things feminine, are more complicated, often contradictory. So we'll keep with the simple male developmental model. So we'll talk about 1.5 to 3 years old. That's when the boy needs to disidentify with the mother and bond with the father. Now the girl has it easier because her gender identity is with the mother. She doesn't have to go through this additional developmental phase. And that might explain why there is more male homosexuality than lesbianism. Because it's harder to be a male. Robert Stoller from UCLA said, masculinity is an achievement. And that goes back to what was said earlier with David. We need the boy needs the support of the family and the culture to acquire the sense of masculinity. But for the girl, it's easier because she maintains her primary identification with the mother.